ABGs can look intimidating at first. pH, CO2, HCO₃, oxygen numbers, arrows everywhere. But in real life, nurses do not guess. We use a system. Today, watch how a nurse interprets ABGs at the bedside, connects the numbers to the patient, works with the care team, and explains what's happening to the family. Our patient is an older adult with a history of COPD. He arrives short of breath, drowsy, and breathing slowly. His family says he's not acting like himself. Family member: he's been more tired today and he keeps falling asleep. Patient: I just feel really tired. Nurse: I'm going to check your breathing, oxygen level, and some lab results so we can see what's going on. The nurse starts with the patient, not just the numbers. She checks respiratory rate, work of breathing, oxygen saturation, lung sounds, mental status, and recent medication history. Nurse: can you tell me your name? Are you having chest pain? Any new medications today? Any pain medicine or sedatives? The ABG comes back. Instead of guessing, the nurse follows the three-step system. Step 1. Check the pH. The pH is low, which means acidosis. Nurse: first, I look at the pH. Low pH means the blood is more acidic. Step 2. Check CO2. CO2 is high. CO2 acts like acid. So when CO2 builds up, the blood becomes more acidic. Nurse: his CO2 is high. That tells me he may not be blowing off enough CO2. Now match the pattern. The pH is low and CO2 is high. They are moving in opposite directions. That points to respiratory acidosis. The nurse connects the ABG to the bedside picture. COPD history, slow breathing, drowsiness, and CO2 retention all fit respiratory acidosis. Nurse: his ABG matches what we're seeing. He's breathing slowly, he's drowsy, and his CO2 is elevated. ABG interpretation is not done in isolation. The nurse communicates the findings clearly to the provider and respiratory therapist. Nurse: patient is drowsy with shallow respirations. Oxygen saturation was low. ABG shows low pH and high CO2, consistent with respiratory acidosis. Provider: let's continue close monitoring. RT: I'll reassess breathing effort. The family needs simple, clear teaching, no jargon overload. Family: what does that blood gas mean? Is he getting worse? Nurse: the ABG helps us see how well his body is balancing oxygen, carbon dioxide, and acid levels. Right now, he is holding on to too much carbon dioxide because his breathing is too slow and shallow. The team is watching him closely. Now let's look at a second patient. This patient has been vomiting for 2 days and feels weak, dizzy, and dehydrated. Patient: I can't keep anything down. Nurse: we're going to check your vitals, fluids, electrolytes, and blood gas results. The ABG comes back. Same system. Step 1. Check the pH. The pH is high, so this patient is alkalotic. Nurse: her pH is high, so now I know we're dealing with alkalosis. Next, the nurse checks HCO₃, also called bicarb. HCO₃ is high. Since pH and HCO₃ move in the same direction, this points to metabolic alkalosis. Nurse: HCO₃ is high and it's moving with the pH. That tells me this is metabolic alkalosis. The nurse connects the numbers to the patient. Prolonged vomiting causes acid loss. When acid is lost, the blood becomes more alkalotic. Nurse: because she has been vomiting for 2 days, she may be losing stomach acid. That fits with metabolic alkalosis. The nurse reports the ABG pattern, symptoms, and lab concerns to the provider. Nurse: patient has 2 days of vomiting, weakness, and dizziness. ABG shows high pH and high HCO₃. I'm also watching potassium. Provider: good. Continue monitoring. Join us at the Nurse Scrub Club, where we make complex topics simple, memorable, and visual. Don't forget to like, share, and subscribe. Bye for now.